Welcome back to Living 808. More than half of all people diagnosed with cancer will undergo some form of radiation treatment. Now, it may be used in conjunction with other treatments like surgery or chemotherapy, but for some cancers, radiation therapy alone can be an effective treatment. Now, here to tell us and help us understand more about how radiation works, Dr. Christina Spears, radiation oncologist with the Cancer Center of Hawaii. Hello, doctor. Thanks for joining us.
Thank you for having me.
So tell me about radiation therapy. What does that involve?
So radiation treatment most commonly means the use of radioactive particles to damage DNA in cancer cells, which will eventually kill them. You can have external radiation, which is one type of radiation, where the radioactive particles are actually generated by a machine and targeted by a machine to the patient or the patient's body. The second type is internal radiation, where radioactive sources are actually implanted into the tumor or the nearby tumor tissue. So the effects are going to be related to that, and the type of radiation that we use really depends on the type of tumor, the site of treatment, and the normal tissue nearby.
Okay. When people hear radiation,
yes,
it's a scary word.
It is. It is. I mean, I can completely understand that. I often tell patients when they come in to see me, I say, okay, most people know about surgery, right? That's a very widespread thing. And especially in chemotherapy even, there's not as much of a stigma attached to it because people know what to expect. But when they hear radiation, they think, oh, Chernobyl and Hiroshima and these scary things. And so most of my visit with them initially is really just to put them at ease and tell them that this is just the third leg in your cancer triage treatment. So it's just another way of treating cancer that can be supplementary to chemotherapy, surgery, or hormonal therapy.
The people that I know that have gone through radiation have actually had really good things to say about it.
Oh,
because, well, I think compared to chemotherapy, and although a lot of people may need both types of treatments,
right,
they didn't get as sick, and it's kind of pinpointed to the tumor. So I mean, you tell me, what are the side effects?
So I think that's a great way to think about it. And I will tell patients, you know, it's all based on where the treatment is going. So for example, chemotherapy is going everywhere in the body. And so that's why you're having side effects in places in the body. That doesn't mean that's where your cancer is. That's just where the medicine is going. And radiation is more targeted, just like surgery is. It's really difficult to tell a patient, oh, you're going to fly through treatment or you're going to have a tough time through treatment, because it really depends on the person. Also, it depends on the site of treatment, the normal tissues that are nearby, just as the decision of what kind of radiation depends on that. So it's important to have a full discussion with your doctor about what the side effects are. But a way to liken it to things that they're familiar with is that you can think about it as sort of being akin to surgery in that same area of the body.
Okay. Is there hair loss with radiation? I feel like there isn't.
There generally isn't. There's local hair loss, which means if you get radiation to the breast, for example, you might have hair loss underneath your arm. And I've yet to hear a woman who complains about that. In fact, women are pretty excited that they probably don't have to shave under their arm anymore. Yes. Really, the only place you'll notice hair loss is if you have brain radiation. And it depends on the dose you're being given. And, you know, with the targeting that we use, I think it's not common to see full hair loss, but maybe some hair thinning if we're radiating the head.
And for someone, you know, chemotherapy, from my understanding, it's like every day for a length of time. Radiation, if I remember correctly, is it like, you know, once a week?
It's actually, so chemotherapy is generally given a number of days. It depends on the regimen, but a number of days, either every week or every 3 weeks. Radiation is the one that's given every week, every day, unless you get higher doses of radiation, in which case you might just do it twice a week or, you know, 3 times a week. It really depends on the dose we're giving you and the intent of treatment.
Okay, so I had that mixed up. Okay, thank you for clarifying
no
that.
No problem.
But really, to get all the information about radiation, because there's so much information out there.
There's a lot of information.
Yeah, it's really just to call your doctor and go down to the Cancer Center of Hawaii, get more information. You guys always have the most high-tech equipment there as well, so it's a good resource for people.
Absolutely, we're always happy to see a patient to address those questions.
Okay, Dr. Spears, thank you so much.
Thank you.